If your dog has suddenly displayed aggression, or perhaps this isn't sudden at all, and actually this is a pattern where your dog has displayed biting, air snapping, growling, snarling, lunging, and this is now a routine in your dog's life, then perhaps at this point, when you're watching this video, you're feeling a little bit hopeless. Perhaps you feel like your dog just can't be cured and there's just no turning back now. Or perhaps you're feeling the inverse. Perhaps you've just started with a trainer and you're feeling super hopeful and you think that no doubt in 12 weeks time, your dog's going to be cured of aggression and everything will be better. Well, in this video, we're gonna be breaking down whether or not aggression can actually be cured and whether or not that's a realistic, attainable goal for you. So if you're interested in solving this big mystery of whether or not dog aggression can actually be cured, keep watching. What's up, guys? It's Jenna with Dog Liaison, where I coach you on how to enhance your dog's mental health. On this channel, we break down scientific research in order to inform us on how to train dogs. So I sat down recently with dog aggression expert Michael Shikashio, who is a bit of a god in our dog training universe. He is one of the leading experts, a keynote speaker at all of our major conferences on dog aggression. And if you're interested in hearing my full interview with Michael Shikashio, you can click this button right here, open that in a new tab, and make sure you check out that full chat after this video. But today we're going to be diving into whether or not dog aggression can actually be cured. Mike explained to me that the first step to unraveling this big mystery of whether or not dog aggression can be cured is to unravel what aggression actually is. See, aggression is behavior. It's not a matter of a broken arm or a virus that just needs some medicine and a band-aid to feel better. It's a little bit more complicated than that.
Now, the difference between, we hear those terms like rehabbed or cured or can you fix this aggression? It's the difference, though, between behavior and medical diagnosis, like, having a virus or a broken bone. We can cure those things. So I can fix somebody's broken bone. We would consider that cured, or give them some medicine to get rid of a virus. We just consider them cured. But the difference is with behavior, once any animal, again, learns a behavior, it's in their what we call behavior repertoire. Those synapses have formed in the brain and they will remember that particular behavior. Our goal, though, with any behavior that we don't want to see again, is to reduce the frequency and reduce the need for that animal to reach for that behavior when a threat is presented.
So on the whole, we need to be reframing what we think aggressive behavior is and aggression in dogs is. Mike gave the example of it not being like a washing machine. You don't just ship your dog who is displaying aggression off to the mechanic and they don't just tweak a couple things here, fix a knob there and unscrew something over here and the dog is brand new. It doesn't work that way. In fact, aggression is a perfectly normal part of an animal. It is a normal part of their behavior, and we need to be rethinking how we quote unquote fix aggression.
Looking at it, taking a step back at it, and looking at the term aggression or aggressive dog, I never label a dog as an aggressive dog. I will look at the behaviors, and that's really important to distinguish the difference. It's just like assigning a personality trait to a person. We can say, Jen is funny, or Bill is uh, an aggressive kind of guy, but that doesn't mean somebody's going to be funny or aggressive all the time. So it's really unfair to assign a personality trait to a dog, like saying that dog's aggressive. It can show aggressive behaviors in some context, but no animal's aggressive 100% of their life because they wouldn't be alive, because they would be just constantly using all their energy towards aggression. So aggressive behaviors is what I look for in certain contexts. So that's really important to know that. Behavior is normal. Aggressive behavior is normal for all mammals, all species, and we've used it to survive for our, as we've developed over the many generations. So same thing for dogs. Aggression is a very normal response, often to a threat at different levels. Barking, lunging, growling, snarling, snapping, and biting, we might consider as aggressive behaviors. And all dogs are capable of it. Some choose not to use it, and some will choose to use it to make something scary or threatening go away.
So Mike was very clear that there remains a significant amount of hope for the vast majority of dogs displaying aggression. So if you're watching this and your dog has displayed a snarl, displayed a growl, bitten, even if that's multiple times, likely there remains hope for that dog in the vast majority of cases. The first step to implementing that hope and to changing your future with your dog is to implement a behavior change protocol.
Yeah, and I think the idea of we want to know if we can cure our dog at the basic level, I think it really comes down to trust. We need to know that we can trust living with our dog. We need to know
Right.
that we can trust our dog living with our 3-year-old child, right? We need to be able there. It comes down to if we think that the thing is cured, then now we know we're safe and everything is better and there's, roses and unicorns.
You said such a key word there, trust, because a lot of times that trust is broken when our dog bites somebody, or us especially. If they bite us or somebody in our family, that human animal bond is often fractured and a lot of that trust is lost. So we have to rebuild that. And sometimes that requires the help of a professional, but it's a matter of seeing that the behaviors can be changed. So getting the professionals to help you often can rebuild that trust because once, just like with people in our lives, we once we see a behavior change, we can start to trust that person or trust the dog again. Yeah, and the great thing is that vast majority of dogs, we can help them choose something else other than the aggressive response if we set them up for success. So there is hope for the vast majority of aggression cases out there.
The first step to implementing that change is to implement a behavior change protocol, which is a big fancy way of saying we want to change the emotional state of the dog. We want to change the dog's perception of that trigger, of that what he perceives to be a threat. We now need to make sure that he doesn't perceive it as a threat. So we're literally changing the association of that thing. The next step being to implement an alternative behavior. What behavior should the dog do when he's in the presence of that now former trigger? What action is he supposed to do when that trigger, when that thing comes into his space? Mike says that if you have a dog that's displaying aggression right now, you basically have 5 options to go from here. You have 5 choices on what to do next. The first being a behavior change strategy like the one we just talked about with management implemented.
So it's the same thing for dogs. When presented with a threat, something you felt you needed to bark and lunge at before, let's change 2 things. First, how you feel about that thing. Let's change it to a positive association where that thing predicts good things happening for you. And let's teach you something else. Instead of barking and lunging and growling at that person, let's teach you an alternative behavior. So we can teach the dog new behaviors to choose from in their brain. So they're like, oh, I can do this instead. And in fact, if I choose that behavior, it actually pays off better for me to choose that behavior. So the old behavior of aggression is still there. The aggressive behavior, aggressive response, it's still there because it's hardwired as a survival mechanism for all mammals. But we can teach them to choose this alternative response. So we don't fix it or cure it. We just make it a lot less likely for that animal or the person to reach for that. It's the same thing we do as humans all the time when we want to break a bad habit, like biting our nails, chewing our nails, or, instead of chewing my nails when I get nervous, I can learn to maybe tap my foot or, do something else to instead of that bad habit that I want to break. So it's always there. I can remember to go right back to nail biting, but if I have a healthier choice to choose from and I get reinforced for that choice, that's how we work with dogs. So, there's several options in aggression cases that a client can be faced with. And the one that we and all trainers hope for is behavior change strategies with management. So really just going all in and committed to this dog. We're going to manage the dog safely around its triggers and prevent any dog bites or aggression from happening, and we're going to put a behavior change strategy in place to help this dog and to reduce the frequency of any kind of aggressive responses. So that's the most rosy picture, right? Sometimes it can be just management. So I go into clients' homes sometimes, and the dog's growling near the food bowl, for instance. Sometimes just management is the quick fix. Just don't stop, bothering your dog while it's eating, or feed the dog in a separate room. And I've had many clients say, "Oh, I never thought of that. That's such a great idea," and that's fit problem solved. It's fixed there. So that's one of the other options, and that can be reasonable in some cases. Um, rehoming whenever ethically and safe to do so. So rehoming or even returning the dog to where the person got the dog from. So whether it's a rescue or shelter, sometimes that's an option. Sometimes the topic of behavioral euthanasia comes to the table.
And I do want to jump in here for a moment and mention that in my next video, we're going to be breaking down when rehoming and behavioral euthanasia is necessary. So with the assistance of Mike Shikashio again, we're going to be unraveling this. So I'm not going to go into detail in this video on what that all entails, but make sure that you're subscribed and hit the notification bell so you get notified when that video drops, and make sure you watch that video next week.
Finally, the fifth option is doing nothing. And sometimes people will do that. They'll say, oh, I guess I really don't have as much of an issue here as I thought I did. Or, they put some management in place already and they're fine living with that. So those are kind of the 5 options that most clients are faced with deciding where to go. And what we can do as professionals and also helping clients understand is going through all of the unique characteristics of their case to see which one of those 5, uh, technically we'd be guiding them in 4, because the 5th one, we hope they don't just do nothing because they hired us in the first place. But we do help them guide that decision-making process now with objective, factual information that they can consider on their own. So now that they have all these data points to say, okay, I've got this going on in my case and this and this and this. Now they can make their own decision with good information rather than all this confusion that can happen.
So fast forward after working with a behavior consultant, a veterinary behaviorist, anything like that, you've worked with your trainer, and now you're starting to see changes in your dog. You're starting to see the green light, you're starting to see the light at the end of the tunnel, and you're feeling a little bit more optimistic. Does that mean that you can just be hands off and not have to worry wholeheartedly about your dog ever again displaying aggression?
So we do have to remember that a dog is a living sentient being, just like humans are. And, I use analogies all the time with my clients. It's just like if we have a child that's having some issues, at school, or we're trying to change the behavior of that child. We wouldn't just send that child off and say, okay, fix this and bring him back to me when he's fixed. It very much requires the parental role and the involvement of that parent to continue. You're getting help, of course, with guidance from a professional, but a lot is going to depend on how much that parent or the person involved in that child's life is working with them. So it's very much the same with dogs, especially when it comes to behavior issues like aggression. It's not like they're a dishwasher where we can just get it fixed and then it's great, and then we can just call the person back if it gets broken again. It really requires much more ongoing involvement from the owner, from the guardian, to make sure things continue in the right direction through the guidance and using the techniques and the behavior change strategies that the professional gives to that client or that person. So really important distinction there, because as living beings, things go up and down. It's never like a light switch where we just fixed. It's there's going to be ups and downs in that journey, and that's okay. No, there's no case I know of that it's just a smooth sailing, quick fix, in aggression cases, if it's true aggression.
On top of giving you hope for your dog and for your future with your dog, I hope that this video also reframes how you perceive your dog's aggression and how you need to move forward in order to prevent, as much as feasible, future aggressive behavior. So with the right training protocol and the right consultant, you can absolutely have a better future with your dog, and your dog can change his perception of his threat. If you're looking for more assistance in how to treat your dog's aggression, I recommend checking out this playlist right here that is completely dedicated to reactivity and aggression. And if you're looking for more science-backed methods, make sure that you hit that subscribe button, hit the notification bell so you get notified when I drop a new video. Make sure to download your free reactive dog case study in the description box below, and I'll see you guys next week.